Malnutrition is truly an epidemic. We know if we address malnutrition before surgery or in cancer, we can change the very outcomes that matter most to not just our physicians, but to outcomes that matter to patients, the things that keep them in the hospital, things that take their lives away. So the key questions that I wish we could teach all of our healthcare providers to ask our patients are simple ones. Have they lost weight? Are they eating less than they usually do in the last week? Do they have a low BMI? Have they lost 10% of their body weight over the last 3 months? Have they lost 5% of their body weight over the last few weeks? Weight loss itself, when not done intentionally so, is one of the very best predictors of complications and risk for things like surgery, things like cancer. If they've been eating half of what they usually eat in the last week, that is a risk factor. That is the very definition that our coders and billers and healthcare system use to help define who actually has a real diagnosis of malnutrition. So a patient who has a low BMI, say less than 18.5, that may be the single greatest risk factor for having an infection after surgeries. And I would say that the recognition and the understanding of how to diagnose and treat malnutrition could likely change the future of healthcare, not just in this country, but around the world, as much or more than any other intervention that we could provide to patients.